Hello. So another update on COVID in Bristol and what we and all our partners in the city are doing to keep everyone as safe as possible. So our case rate, good news, is down to 111 new cases per 100,000 population over the last 7 days. This is now just below the England case rate of 118, and there's a continuous fall for us. Remember, it was just a few weeks ago we were in the high 400s. Approaching 500. But again, this is still a high number. We were in single digits, last summer. We need to remain cautious, not get prematurely overconfident, continue to follow the guidance of hands, face, and space to minimize the opportunity the virus has to spread among us. On the vaccinations front, they are now available to people aged 65 to 69, people aged 16 to 64 who are classified as clinically vulnerable because they have a range of clinical conditions that increase their risk from COVID. People recently added to the updated shielded patient list also. If you are aged 65 to 69, you can book an appointment at Ashton Gate Vaccination Centre or at one of the 7 local community pharmacies. You can do this by visiting the National Book Service on the NHS website or calling 119. Okay. Alternatively, you can wait to be contacted, but if you don't hear anything, please do reach out. If you have underlying health conditions or have recently been added to the shielding list, you will be contacted to book your vaccination appointment, but please do not contact the NHS. Now, community surge testing ended on Sunday, the 21st of February. We completed over 40,000 tests in Bristol and South Gloucestershire, which is an incredible turnout. So thank you to everyone who participated. To achieve this over that period of 2 weeks shows an incredible amount of hard work and community effort. If you have not been able to return your completed test, please dispose of it safely now in your household waste. Huge thanks to everyone, as I said, who came forward. Out of these tests completed, just under 1% have come back positive for coronavirus. All positive cases found in the 2-week program window have been sent for further analysis, what we call genomic sequencing. And the results will take some time to get back. That will give us a knowledge of the variant. The presence of the variant in Bristol. Public Health England, they're going to work incredibly closely with us to review the results and provide ongoing guidance and support. If you want more information about the different types of testing in Bristol, you can visit the Get a Test section of our council website. But the fact that we are under 1% positives from that sample size suggests to us that there isn't a high prevalence in the background of people with COVID. There's not a high prevalence that we don't know about, which again is positive news in light of what could be the case. Now, government have announced a 4-step roadmap to take England out of national lockdown restrictions, and we obviously welcome that news, that hope. It begins on March the 8th. When all schools, both primary and secondary schools and further education colleges will open or begin to open. We recognise this, and more social interaction will make some people anxious. We do have to respect that, so please do consider other people and the levels of anxiety in going through this. We've always said that schools are best placed to make decisions about how they reopen, and we'll continue to support school staff, parents and children in doing so. We know lots of people have struggled financially, emotionally and mentally during this difficult lockdown period. We're going to do everything we can to support our communities as we have been in transitioning out of lockdown safely. If you need any support, please contact the We Are Bristol free helpline. Call 0800 694 0184. Okay, it's open Monday to Friday, 8:30 a.m. to 5 p.m. and Saturday and Sunday, 10 a.m. to 2 p.m. And there is a 24-hour-a-day, 7-day-a-week helpline, 0800 012 6549. This is also available for people in Bristol to get immediate emotional and practical mental health support as well. This is a high pressure time. If you're feeling it emotionally, you should not feel any sense of stigma or defeat within that. We are all feeling burdened by COVID, and this is a perfectly natural response. And as social beings, it is perfectly natural for us to want and need other people to come alongside us and to get that support to get through our trials. So please make use of that helpline if you need. Rough sleeping has been a huge feature of our COVID response and tackling that. I think we've helped around 1,400 people over the period move on into some form of temporary accommodation and many to move into permanent accommodation as well. 50 people were found sleeping rough in Bristol during the city's annual count in November. That's a significant decrease from the 98 found at the same time the previous year. And since then, the amount of people found on the streets has fallen further. 21 people recorded rough sleeping in January. Now, Bristol's positive action to get people off the streets during COVID-19 has driven that change. Like I said, incredible numbers who've been supported. But we are expecting a potential new wave of homelessness. And this follows the end of the eviction ban and other economic challenges in household lives coming from the pandemic. We are meeting about that. We're trying to anticipate and get ahead of that. And I'd like to thank all the staff and our partners who've come together to anticipate and trying to get ahead of that challenge and make sure we support people and we don't end up with people falling into dire accommodation woes. Yeah, we'll continue to work on that. We do need government support to be able to achieve our ambitions. That's the brutal reality. I just met with MPs this morning and talked to them about the voice they will take to Westminster to make the case for Bristol, which is what we urgently need. Without government support, it's going to be a very challenging time for us, and we will see the worst possible outcomes. So we know we also need to reduce the number of people living in temporary accommodation. It has been a city priority for us. The only long-term solution to this problem is to build more affordable homes. And again, since we've come in, that is what we've absolutely focused on, getting homes built in very challenging circumstances. But if you think that you or a friend or family member might be at risk of homelessness, it is really important to seek advice as soon as possible. And visit our website, bristol.gov.uk/homelessness for more information. But we just continue to urge you to take care. Our numbers are going in the right direction, but we still need to stay vigilant. We still need to be careful. And even if we don't feel threatened by the virus ourselves, please do think about those people who will be facing incredible anxiety, who will be vulnerable, and make sure that we behave around them accordingly. Take care.